Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Women's Health Checkup. Introduction. Regular health exams and tests can help find problems early or before they even start. As a woman, you need some special exams and screenings. Regular checkups provide a number of benefits to women. Screening tests, such as breast exams and Pap tests, can find diseases early when they are easier to treat. This program explains the different exams a healthcare provider will perform during a woman's annual health checkup. Screening tests. Screening tests helps healthcare providers look for diseases before you have symptoms. They help healthcare providers find diseases early when they're easier to treat. Which tests you need depends on your age, sex, family history, and whether you have risk factors for certain diseases. After a screening test, make sure you know who will give you the results. Some conditions are commonly screened for during regular checkups. These include cancer, diabetes, high blood pressure, high cholesterol, osteoporosis, excess weight, and obesity. Some conditions that healthcare providers commonly screen for are unique to women. These include breast cancer, cervical cancer, reproductive system problems. The rest of this program discusses the screening tests and exams that are unique to women. Pelvic Exam. A pelvic exam often happens during a routine physical exam. It is done to find possible signs of a variety of disorders, such as ovarian cysts, sexually transmitted infections, such as chlamydia or gonorrhea, uterine fibroids, early-stage cancer. Your healthcare provider can recommend how often you should have a pelvic exam. Many women have one once a year. Your healthcare provider may also recommend it if you're having symptoms such as unusual vaginal discharge or bleeding, pelvic pain, skin changes, urinary problems. During a pelvic exam, your healthcare provider visually and manually assesses your reproductive organs. A pelvic exam is a relatively short procedure. During a pelvic exam, your healthcare provider checks your vulva, vagina, cervix, uterus, rectum, pelvis, ovaries. During the pelvic exam, you will lie on a table with your feet on the corners. They will be placed in supports called stirrups. The healthcare provider may ask you to slide to the end of the examination table with your knees out to the sides. A pelvic exam is usually not painful, but some women may feel uncomfortable, scared, or nervous. It is normal to feel this way. Your healthcare provider can help you relax by explaining the procedure to you while it is performed. You can ask your healthcare provider for a handheld mirror so that you can observe the procedure while it is performed. If you feel too uncomfortable at any time during the exam, or you feel pain, share your feelings with your healthcare provider or ask him or her to stop. Your healthcare provider will first perform an external visual exam. He or she will inspect your vulva looking for irritation, redness, sores, swelling, or any other abnormalities. Next, your healthcare provider will do an internal visual exam. He or she will use a speculum to spread open your vaginal walls and view your vagina and cervix. The speculum often is warmed before it is inserted. When the speculum is inserted and opened, some women feel pressure or discomfort. To ease the discomfort, try to relax. Because your pelvic organs, including your uterus and ovaries, can't be seen from outside your body, your healthcare provider needs to feel your abdomen and pelvis. This is known as a manual exam. During a manual exam, your healthcare provider will insert 2 lubricated gloved fingers into your vagina with one hand. The other hand will press gently on the outside of your lower abdomen to inspect the size and shape of the uterus and ovaries. It can also help your healthcare provider find tender spots or unusual growths. After the vaginal examination, your healthcare provider also inserts a gloved finger into your rectum. He or she will check for tenderness, growths, or other irregularities. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Pap tests. Pap smears can often catch cervical cancer in its earliest stages, many times before it has even progressed to being cancer. The age when women should have their first pap smear varies by country. In the United States, women should generally start getting pap smears at age 21. The number of years between pap smears also varies by country. In the United States, a woman should have a pap smear every 3 to 5 years, depending on her age and whether she also gets an HPV test. Some women do not need a pap smear. This includes many women over age 65 and some women who have had their cervix removed. Ask your healthcare provider for more information on whether you need a pap smear and how often. When cervical cancer is caught early, more than 90% of cases are curable. When a pap smear finds precancerous cells, they usually can be effectively removed. This prevents the disease by getting rid of the abnormal cells before they have a chance to become cancer. During a Pap test, you lie on your back on an examining table with your knees bent and your feet placed on the corners of the table or in supports, called stirrups. Your healthcare provider inserts a speculum into your vagina. He or she will take samples of your cervical cells using a soft brush or a flat scraping device called a spatula. This usually doesn't hurt. The cell sample will be sent to a laboratory where they're examined under a microscope to look for characteristics in the cells that indicate cancer or a precancerous condition. Ask your healthcare provider about when you can expect the results of your Pap smear. The results will be negative if you have all normal cells. You won't need additional testing or treatment until your next Pap smear and pelvic exam. The results will be positive if you have any unusual or abnormal cells. This does not necessarily mean that you have cervical cancer. A positive result can mean different things depending on what type of cells are found. Sometimes the results of a Pap smear come back negative when there actually are abnormal cells. This is called a false negative. This could be because there were not enough cells in the collection. There are only a few abnormal cells. Blood cells or other cells make it hard to interpret the results. Cervical cancer develops over many years, so if the first tests come back as a false negative, the next test will probably detect any abnormal cells. About 70% of all cervical cancer is caused by HPV, a sexually transmitted infection. In addition to Pap smears, the other key step you can take to prevent cervical cancer is to get the HPV vaccine. The HPV vaccine is recommended for girls 11 to 12 years old, but it can be given as early as age 9. Girls who are 9 to 14 years old need a series of 2 shots, 6 months apart. Older females, up to 26 years old, need a series of 3 shots. Side effects of the HPV vaccine are uncommon and generally mild. The HPV vaccine has proven to be a safe, effective anti-cancer vaccine. With regular Pap smears and proper follow-up, even women who have had abnormal Pap smear results can often be effectively protected against cervical cancer. Talk to your healthcare provider about a care schedule and your prevention options. Breast exam. Breast cancer affects 1 in 8 women during their lives. Thanks to screening, breast cancer can be found early when the chance of successful treatment is best. Early breast cancer usually has no symptoms. Later, as the cancer grows, it may cause a lump that can be felt in the breast. Sometimes the skin over the tumor becomes coarse and wrinkled. Discharge from the nipple can also be a sign of breast cancer. Most breast cancer cases are discovered either by a mammogram or clinical breast exam. During a clinical breast exam, your healthcare provider examines your breast. A mammogram is a test that uses X-rays to look at images of the inside of the breast. Mammograms can be used to find cancer that has caused lumps or cancer that cannot be felt in a breast examination. Your healthcare provider can help you decide how often you should have a mammogram and when you should have your first one. Mammograms should be started earlier and done more often if a patient has a family history of breast cancer.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Regular checkups provide a number of benefits to women. Screening tests, such as breast exams and Pap tests, can find diseases early when they are easier to treat. Which tests you need depends on your age, sex, family history, and whether you have risk factors for certain diseases. After a screening test, ask when you will get the results and whom to talk to about them. A pelvic exam often happens during a routine physical exam. It is done to find possible signs of a variety of disorders, such as ovarian cysts, sexually transmitted infections, uterine fibroids, early-stage cancer. Getting regularly scheduled Pap smears is important for almost all women. Pap smears can often catch cervical cancer in its earliest stages, often before it has even progressed to being cancer. Breast cancer affects 1 in 8 women during their lives. Thanks to screening, breast cancer can be found early when the chance of successful treatment is best. Thank you for using Explain.